You see, a lot of people think they show their degrees or their certificates and say, this is what I have. The degree and the certificate is not the one that does the work. The person that does the work is you as a human being. And so you've got to have a very high sense of awareness. So when I say that, you really got to know your personality. You've got to know how you relate to other people, and you've got to be able to appreciate what you're good at and what you're not good at, and then try to keep learning. It's a much abused word, which is called attitude. Yes.
Okay. Welcome to Daktari Tone, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care. Welcome back to another episode of the Daktari Tone podcast with me. I'm still joined with Gordon. And we've delved into the bigger picture of his journey in the leadership around healthcare, as well as his leadership style. Now let's just move a little bit into now another bigger picture, which is around the healthcare system and policies. And I have a very interesting question for you, Gordon. If you had the Minister of Health, see us for a minute, for 5 minutes, let me add it, minute is nikidogo. What would you whisper, or what policy would you pitch, or just whisper to his ear?
I think I would say leave politics out of healthcare. Healthcare is about people's lives. Can we just focus on how we can improve health indicators for people? Reduce maternal mortalities, reduce childhood mortalities, enable access to cancer treatment for all citizens, find practical ways of reducing the cost of medication, and also encourage local manufacturing of drugs, because that will tremendously reduce the average cost of providing healthcare service in this country. And on top of that is try to find ways to have a motivated workforce, because the industry is now so rested. We just have a plethora of strikes in the healthcare industry.
Okay, now you touched on something great. Now that is leave politics out of health. Separate those two. That's your advice, if I'm getting it in lay's language. Now, where are we at, or how do you feel that politics is impacting healthcare in Kenya right now?
I think looking at the recent disruption in the healthcare system, you'll find that it's actually being driven by a huge political agenda on a very noble idea, which is a universal healthcare coverage, which all nations in the world are aspiring for, and it's a global standard. To be able to achieve universal healthcare coverage, it's got to be a stepwise thing, because universal healthcare coverage actually needs a payer. So you can't really go into it until you've actually figured out how all of this is going to be paid for. And I think that's where the big challenge is. And also, when you do it, can you not ensure adequate rollout without the disruptions that we are seeing in all this, in all these things? Because we had a good working system in NHIF, we should have maybe just enhanced and improved it.
Okay, now we've got the government, we've got the NGOs, we've got the private sector, we've got the civil society, but we get that, and which I'm picking from our first conversations, the conversations we've had prior, where you did talk about team and conversation, communication. So what you find that all these stakeholders, or these groups, because of course they are in the same market but different, we find that they do not play well together. What is the secret to better collaboration?
I would say that all the players need to be recognized for their contribution that they're giving to so there's a room for the public sector, there's a room for the NGOs, there's a room for private hospitals, there's a room for all these different clinics. But what sort of differentiates these things, that there's a lot of talk about good things, in terms of digitization, but it's hardly ever implemented. And then how do you bring all these players together so they can all play their part in actually uplifting the health status of all Kenyans? I think that to me is usually the biggest challenge, to get everybody talking together and having a common approach and a unified objective, which puts Kenyans at the forefront of everything.
Okay. Interesting. Actually, that cut across our conversations just prior with your leadership style and everything. So now let's go to SHIF, the Social Health Insurance Fund. To you, what works and what doesn't?
So when I look at it, it's a novel idea. But I tend to see that we didn't capitalize on the gains of previous initiatives in universal healthcare coverage. So the previous gains were trying to pick up diseases or illnesses, which is largely the non-communicable diseases that the normal standard insurance companies are not paying for, and allowing access to people. So it is allowing access to the elderly, it's allowing access to school children, it was allowing access to people in the informal sector in a very structured manner that they could actually go to high quality facilities and get treatment at a cost that would actually cover the reimbursement. SHIF, when it came, has taken an aspect which everybody would run away from, it's my opinion. Its focus has been on primary healthcare services. Primary healthcare services in a country with a population of over 60 million people, and a lot of people are ill, indigent and poor, then you open up a Pandora's box of treating very many people, but you're not treating them along the full spectrum of care that is needed. I think that's what the challenge is. It's limiting reimbursements, it's limiting access, it's limiting even how you pay for those services, and it's not linked to the resources that are available. So if we're able to take a step back and say, okay, should we not maybe change the way it's looking? And also, it's not funded. The source of funding is primarily from people who are in payroll employment, and the estimates have indicated that cannot be able to cover everybody. So we've got to find ways that we're actually able to cover a very good noble idea, and then, as you've seen in the newspapers, eliminate fraud. Because what basically happens, this happened in the 90s. It's a deja vu moment, where people rob the National Hospital Insurance Fund. And
of course, there'll forever be opportunities.
And so it's happening again. The people are very quickly looking at what the gaps are, and they're trying to play in places where there are gaps, and they're getting reimbursed for services they've not provided, which in the end may lead to people who need the services not getting treatment because of wastage.
If you could fine-tune it to deliver better results, what would you change?
I think for me, the anchor in all these things is the information systems that you put in that actually can be able to control all these things, so that you actually be able to see everything. You're actually able to have better control, so that you're not how do I call it? You're not treating numbers which are not patients. You actually need. So let me give an example. If you had a cover that covers surgeries, how many surgeries can one person have? If I have my appendix removed, it have it once, isn't it? So you've got to put controls whereby people cannot have multiple procedures, multiple care, and all these things inside, because you've got a very good system that will actually eliminate and check all that.
And what would be your advice around SHIF or SHA to the government, to the hospitals, the practitioners, and even patients?
Okay, if we start with the patients, my thing is to encourage people to enroll. Yes, because in my view, even using the means testing, a lot of people who we have a huge number of people, of Kenyans who are poor. So those people who should find ways of being able to enroll, and if they cannot enroll, the government should find ways of actually paying for them, because actually there's nothing worse than falling ill and you cannot seek treatment. So that's the first thing. Take that cover and do it, but don't do the controversy. For the government, I think they've got to meet their promise. It's not a question of saying that nobody will pay for healthcare, while in reality, the reimbursements can't cover those services. We've got to also find those mechanisms that if they promise that it's full universal healthcare coverage, let them ensure that all those procedures are in place to be able to make that work.
Okay. Before I go into the next part, I'd like you to ask me a question so that you can also have a breather.
Are you paying?
Good question. Hey, that you put me on a spotlight. But anyway, I haven't yet.
And why aren't you?
Well, because I have to be honest. Because I'm still in the struggle of balancing my bills.
Because it's going to answer the question why a lot of people also are not taking shift for SHA. You understand? These are all insurance things, and the current population is largely made of young people.
Other than that,
yes.
Okay, if I was to give another reason why, it's because, to be honest, I rarely get unwell. That's what I'll go for. So, I don't know.
Accidents?
The favor and the grace and the mercy of God upon me.
You see, so
God is so gracious to me.
So that's our biggest challenge.
Yes,
is how do you as a nation communicate to people about the need to have medical insurance and not leave it? The biggest thing that's between you and poverty is just one accident, one illness away, and then we're going to be changering for you and whatnot.
And then, that
kind of thing. Well, if people understood the value of medical insurance, and it's also easier to actually sell all the government policies. The whole thing, the challenge with medical insurance is that the people who are sick are the ones who are buying it, and that defeats the whole purpose. Because then you're going to deplete the resources. So yes, as much as you can blame the government, you've also got to look at how everything is being communicated to people on the need for people to have some kind of medical cover.
I would like you, so that we don't go further, try and convince me the reason why I should not pay with the reasons I've given you.
It's something called risk.
Okay.
So you are right. As a young person, you're the healthiest that you can be. But you're childbearing age. Yeah. So there are risks in maternal care, and maternal birth. You can't leave it to God. And if you have a good cover,
I still leave it to God anyway.
Then you have the choice of facility, choice of doctor, choice of service that will ensure that you have good outcome for you and your child. And when your child is born, because the first 5 years is the most vulnerable. And so you don't want an episode where, and you've seen it in newspapers, you're a journalist, where patients are stranded with their kids in India and whatnot, they don't have money to pay. And it's not a lot of money, but if you have covers that you take as a family and yourself, even for nowadays it's very good. Even your elderly parents can buy covers, So it saves you on out-of-pocket expenses and financial doom.
Well, now, yes, you've done much of convincing, especially when I'm looking forward to be a mom and you've touched on maternal care. Okay. Now, this is to both tie our previous conversation and now, and because you've tried to convince me. So it's a fun question.
Yes.
If leadership had a superpower, or if you wish to have a superpower, what is that, one thing you'd wish you had?
That goes against my personality of being a team player and not being able to have a magic wand. But I for one, encourage people working with a sense of urgency. To get past procrastination and saying, why don't we do this in 2026? Why not start it today now? Because 2026 will surely come. By saying you'll do it next year doesn't mean that you're not still going to confront the issue. So for me, it's how do you actually get people to have a sense of urgency? That the task at hand should be completed now. Everything needs to be started today and completed, and we move forward and try and get the resources and get people together, mobilize around an idea and execute.
Okay. Now, my next question leads to our next part. So, what is that one innovation you've seen in another country that you wish was in Kenya?
You're talking about healthcare?
Yes, that healthcare innovation, or you had mentioned actually you're in part of now when you've stopped now being an employee and employer both. You're now partly in consultancy.
The healthcare field is innovating every single day.
Yeah.
So, for instance, this last week or so, Russia announced a vaccine against cancer, and I asked myself, when will this vaccine? They're going to give it for free in Russia. When is it going to be commercially available to people in third world countries? You know, so that to me is because right now we didn't know people are living longer. Cancer is now a real big killer within our society. So how can we quickly bring that kind of vaccine to stop early deaths, either children, adults, or people in midlife?
Okay.
So to me, that's something we look like to see.
Okay, we've talked about Russia and the cancer, and now our next part is on future outlook, the healthcare. The future of healthcare in Kenya. And from your own perspective, what's the next big shift in Kenya's healthcare?
I wouldn't say looking at a big shift in healthcare. I would just say that the shift that needs to be there is to bring equity back into healthcare. Because people who have money have got access to the best healthcare in locally, they can go internationally, wherever it is. The people who don't have money are doomed to low standards of healthcare. But I think for me, the biggest shift in healthcare is to not look at healthcare alone. Healthcare is caused by the environment we live in. You know, we worry about the water we drink in. Yeah, we worry about the containers the water is in. We worry about pollution. Yeah, we worry about obesity. We worry about just general pathogens that we're not being able to control. And when you look at other countries and all, they have eliminated infectious diseases. Well, for us, infectious diseases is still a big thing. We're not in control of that. Then we need to be able to prioritize lives. So we count them as statistics, but one child dying before the age of 5 is somebody's child. A mother dying during childbirth should be avoided. So what are we going to do as a country? That to me is the biggest shift. It's not about technology or other things and big stuff. It's how do we just sort out the fundamentals, but looking at it as from different aspects of things that impact health. Housing, for instance, is a cause of asthma, pollution, rickets. So you're finding a boom in apartments, but that's going to cause serious health
conditions,
problems, which we're going to see. We can't see now, but are we thinking through those thoughts? It's nice of a nice apartment, but are you getting enough light, enough ventilation? What's the quality of air in those apartments? Why are you disposing of your waste? Are the children getting exercises yourself? Are you spending too much time in artificial light? Are you getting sunlight? So move away from looking at health from curative.
So it being now the solution before us acting on.
But we look at everything from lifestyle issues, the things that impact health. What are we eating? As we modernize and we urbanize, then we're seeing, I don't like convenience stores. That's something personal, because all they do is sell sugar in different forms. It doesn't say sugar, but when you look at that, it's the shop is 95% full of it's sugar, by the way, and we are getting so used to that, and those are future problems.
Now, as much as you did mention technology as it's not a matter of technology, that's how you started it. Still, I'll take you back to technology. How will technology, according to you, change hospital management in the next 10 years? So
okay, I don't even need to talk about next 10 years. Okay. I'm talking about practical experience, where I run a hospital which is 99% paperless. So when you're completely paperless,
this is when
it's because when that's how they get to Children's Hospital.
When you started?
No, by the time I left.
Oh, yes.
Which was 9 years ago.
But then when you got in, there was still paperwork.
There's no paper, but we use technology. And so that saves time for your healthcare workers to be at the bedside with the patients. So that's where you use technology.
Actually, that's
you move people away from filling forms, filling reports.
Actually, you're reminding me of someone telling me, you remember when you used to carry a small book? You're carrying a small notebook. Actually, it was an exercise book, a green one then.
Yes.
And we were going to the hospital. It was a county hospital.
Yes, and they still sell the book.
And then every time again you have to go, you have another new one. Yes. You have a new one. And I'm like, how will this doctor keep the record of? But then now it becomes easier. They just go click, either there's a code or your name or an ID number if you're above 18. And everything comes.
Yes.
Everything is there. The doctor even you saw last, what medicines you got to get from the pharmacy and which ones you didn't.
Yes.
And to me that is super interesting because it's even easier to get to know how the patient's journey.
It's called continuity of care.
Which
it allows for you to continue the care.
Now let's turn down to management because I feel you are more in the managerial positions.
Yes.
Which of course all that comes even from you now saying like let's move from paperwork and large books and all this bad handwritings of not as seeing, okay, doctors also have handwriting that you cannot see. But then you see, being a patient, you're unwell, you're told to feel. You're there crying or having pain and you just have to feel.
Yeah.
Because there's no other way around. That's the first process before seeing a doctor or anything. Yeah. So let's move now technology to the managerial aspect of it in the healthcare.
Yeah.
Yeah.
Technology. Managerially, it's just the use of data for decision making. So there's tons and tons and tons of data that hospitals generate. So you'll easily be able to look at patients from gender, age, disease pattern, and then you can put those into seasonal, whatnot. So you can help you with planning.
Actually, a good simple question
yes.
that maybe most of us, or personally me, I would want to assume that I know what your J or D was. Please tell us, what does a CEO in a hospital do? Please. We see a doctor who will know this is a gynecologist, this is a pediatrician, or this is a nurse who will use it at the theater area or at the,
So let's start from the beginning.
Okay, let's start from the beginning.
I once spoke to a CEO of a public hospital, and he told me that his biggest nightmare was when the employees having unrest, that then he would get a text and they'll tell him, we're going to turn off the oxygen. We're going to turn off the oxygen.
Like almost like a strike or something?
Yes, they're going to turn off the oxygen tonight. So who will be on the newspaper cover tomorrow? Is the CEO.
You have to explain to us why.
Yes, so the CEO is fully accountable for every single action of every employee in that hospital. So if an employee gives a patient the wrong drug, you're fully responsible. So the CEO's job is not so much what do you wake up and do, it's how do you set up systems and controls that first you ensure there's no waste in the hospital, you ensure that the right quality of care is provided, you ensure that your employees come to work, they're motivated, well looked after, and they're performing at peak. And then you've also got to look after your stakeholders, which are people in and without. The patients, you've got to look about funders.
I'm trying to live it as your life, and I'm like, where?
Yes.
So that means you have to just be a disciplinarian. You have to be aware of a day, not even a week's.
You have to you set up systems
there's systems, but then you've mentioned something that has had my eyebrow like, what? Okay, wait, because if something happens, let's say I am a nurse and administered maybe, or let me give you a scenario, a good one, okay? Which can happen by, it's not anything around incompetence or negligence. Let's say interchange of shifts. So maybe the nurse who left just because it was just like a minute to, giving medicine to a certain patient, he saw that, let me just give it. Of course, now there's the record, but then maybe she didn't, or maybe it was overlooked by the next nurse. And then the next nurse comes in and does the same, gives the same dose. Now it becomes an overdose. See?
Yeah.
And then maybe something dire happens.
Yes.
You see, that's really like, to us, it's like something that it's really from the lower, it's in the lower, before it reaches the CEO, it's now when something, it has gone, overblown to something that is now, it's out of our hands. We cannot handle it anymore.
So if you use data, you'll be able to get reports of similar incidences like that. And then you track over time and say, well, we're having too many of this. Then you find out what is the root cause analysis. So there are very simple standards that are set in place. That certain drugs cannot be administered by one person, as a control, so that somebody can check and see, is this the correct drug? Is it being administered in the right, through the right method? Is it the right dosage? So you find that when you start noticing such lapses, using your data, then you're able to stop those things from happening. They're the things which they should not continuously happen in institutions, organizations. Yeah, so that's why I keep telling you about system standards and controls.
Okay, so you've given me, I think, with the whole explanation from your friend CEO of a public institution. Now, just give us like 2 more roles. You can be direct of what a CEO does, still to give us a whole picture. So I know you've given us
for financial. One of the big responsibilities, you've got financial oversight of the institution. So when you say financial oversight, you've got to have adequate control systems so that if you're having revenues, it all gets accounted for. And then you've also got to have systems in place that you minimize your costs, you minimize wastage, you minimize losses. So that's a really big part that we do. Then you've also got to, as a CEO, you've also got to manage other key stakeholders. So stakeholders could be like your board, which gives oversight over you. So they've all got very different interests, different personalities. So you want to manage those stakeholders. Then, about full time, you've also got to you're the public image of that organization. So wherever you go, remember that you're carrying the badge of that organization. So that's so you're the spokesperson, you're the visible eye, you're the image of that organization.
I have, some quick fire questions for you. And if I get to the quick fire questions, I'd like you to ask me a question as well.
What do you really think a CEO does?
Wow. Okay. I feel my answer will be more clouded because, let me say.
Forget what I've said. In your mind, what
do you think it's easier for me to forget what you've said? You're just asking me to...
Anyway. So the perception.
Okay, yes, the perception.
The perception is normally that he's just a big boss, has a lot of cups of tea.
Not really.
All those people around.
Okay, when it comes to, if you specify, if it was a CEO in the hospitality area, maybe I would have said that because it's more of happy food, and that's how my whole perception or perspective around hospitality. But then when it comes to hospital, you ask me what a CEO does. I feel like it's more of he's more of a coordinator.
Yes.
Because you see, I feel like a hospital is a whole diverse institution.
Yes.
It's just like, if I was to break it down, it's just like almost like a school.
Yes.
Because you see, it has segments. It's not we have the elderly, we have children's section, we have a nurse, we have a CEO, we have a pharmacist, we have a dentist, we have all that. These are very many names.
Yes.
Which there's one line that joins them, but then it can lead to a whole fumble or breakdown if we do not have a systemic or one person whom we answer to or who can help us communicate or coordinate. So I feel a CEO can come in now as someone who gets to get the communication across that institution for it to even make sense and to be streamlined towards the goal. Because if we don't have that leader, it will seem like the Bible part where, people were confused until now God had to bless them with a king and still tell them to suffer. But anyway.
Okay, very good. Well done.
That's my before if I forget.
Well done.
What do you think about my answer?
Very good. You're understanding the business. Because somebody once told me, again, when they joined from another industry, they came from manufacturing and they were working there, and they said, hey, man, I didn't know this. The hospital is many businesses in one.
Hey,
you're running. The way you've just put it is true.
And how did you? Okay.
So you're running a pharmacy business. You're running a laboratory business. You're running
a theater.
You're running
someone is having an open heart surgery somewhere. Another one is
hotel.
Oh my God.
You're running a hotel business.
Yes, because
Yes.
again, we still have to need the
But, yeah, you
aesthetic
have
and
to feed.
an eatery.
You have to feed them, give them bread
Nice
and
food.
feed
Because
them.
again, I'll be like,
Yes.
you see,
Yeah.
and of course, we still blame you if you
Yes.
eat bad food. Be like,
Yeah.
why are we eating?
So see, to sum it up, it is a complex business.
But then
And
how did you
people
handle?
don't-
Because I find it to be very complex. As much as it may be they may be small when it are specific. Like when you just talk about one line, it can be not so taxing or tasking.
So the everything is not on the CEO, as you put it. You
So
have
I'm
to
still
you
right.
have to work with teams.
Still like I'm
Yeah,
the board.
So if you've got your board gives oversight, then you've got your senior management team. And the senior management are the experts in the different lines that you put them. So you have somebody in HR, somebody in finance. So you've got your director of nursing, you've got your head clinician or medical director, you've got your chief pharmacist, chief of laboratory. So that's your team that you hire competent people who can lead all that. And your big job is to make sure that the patients flow seamlessly through all these departments. Yeah, because that's the one product that you have is a patient.
What is your hobby?
What is my
hobby?
At my present moment, I enjoy walking and swimming.
You
swim. So but I've not done it of lately.
Please do it again.
But I enjoy because those are the two things I found gives me solitude. Because when I take a long morning walk, 1.5 hours or an hour, I do that without my phone or anything with that. So that's the time that you have enough time for reflection, you have time to with nature. And the same thing as you take a swim for 45 minutes. I know. You can't go in there with your phone.
You've said present. So what was it? What was your hobby then?
Added to that, I also used to play golf. But I play less golf now.
You know, when we hear people who play golf, hey, yo. We hear the six of the 6 zeros.
So golf also involves walking. Remember?
Of course, yes, it does.
So I enjoy a good walk. I don't hike, but I enjoy a good walk.
Okay, actually, we have this perception of what people play golf. I don't know if it's true. Maybe you might confirm it to us.
Perception?
That there are people who know who.
So it's true. The majority of people I've known in my life, I've known them through playing golf. Golfers are extremely friendly people, and golf makes you play with other people. So you play individually, compete with other people, but it also you spend a lot of time with people. So you actually get to know people through playing golf.
Do you have another question for me before I start the quick fire?
When are you starting to play golf?
Hey! Could you, with that question, if you refer me to someone or to, how do I even start? That's a good question.
There's public golf course on Gong Road.
Maybe so I don't want to make promises.
So all you need to do is they can even rent to you.
Oh, you can sign up?
You just sign up.
Is there like a
You don't have to be a member. You just sign up and once a week they can even give you lessons and you can play. Okay.
But of course there's a fee.
Yeah, there's a fee.
Why is it that again my perception is just clouding the judgment around it being not too cheap?
It's not well, cheap is relative.
Okay, yes, of course it's relative. Okay.
Yeah, but we choose where to spend our money. So if you want to play golf, among other things, you'll do that. Well, if you rather do something else. Because
you've asked me that question, that means it's interesting.
Yes.
Well, so what interest do you find around golf other than the walking part?
Because people who play golf, it teaches you about what I learned about golf is that if you led your life, life you can always apologize and go back.
Yes.
Golf, if you hit your ball in the water, it's gone.
It's gone. Disappeared.
Yeah. So every decision you make, weigh the consequences.
You have to be very careful.
So you've got to choose the right tool. You've got to know the right distance. You've got to write the right position because the penalties are huge. Yes.
Okay. Now, what's the best career advice you've ever received?
So when I reflect back and it was a chat with somebody who is still a leader in the hospitality industry, and I just listened to to a conversation, and it's called the concept of the green pastures. So he said that the mistake everybody does in life is to look at somebody else's pasture and you want that one because it looks green.
Ooh, yeah.
While he was saying, why don't you water your own pasture? So it's the one that people want. So when I look upon that, I think it's sunken, because if you look at it, I worked for 17 years in Gertrude Children's Hospital. So I spent the time watering my pastures, then looking out to other pastures. So that to me is and then he said, somebody else in my office was very good. He was an office assistant and a pastor. So once we in the neighborhood where we lived, where we worked, was Mufaiga, and sometimes you go there and the lawns are really green. And he said, don't admire those lawns because the water bill is higher. The guy on the other side. To keep it green. So sometimes you don't also see the cost of the green pasture.
You just admire it, but then you do not know what work was put into it, or what. Okay, with the way you put it, the water bill is expensive.
Yeah.
Okay, now a career mistake that taught you a lot.
I think for me is it's not, would you say a career mistake, because I've not worked in many.
Okay, a career challenge.
I've not worked in whatnot. So in your career, the thing I learned about is not getting upset when people leave. Because we invest a lot, like particularly in healthcare. You have very competent staff, whether doctors or nurses. And then I learned that you need to work with those people when you have them, because everybody has their own personal ambitions, which may not align with yours as the organization. It took me a while to be able to accept that. And what other organizations do, they stop training because of the loss of people through attrition. For me, it was the opposite. You say, just train people and use them for the skills that they have for the time that they're with you.
Actually, when you said that, I remembered when someone asked you, I cannot imagine not working with you anymore. So it has happened to you as well. Of course, that's why I think I mentioned by saying that you must have been really good at your service for someone to have said that. Now, a book. No, before I ask that, a question for me.
I'm just curious. How many years have you worked?
Before I answer that, why? Yeah? What am I giving off?
No, but see, because you're talking about careers.
Oh,
so I'm trying to you're a journalist. So I'm trying to figure out how long you worked in that career.
Okay, I would say 4 years of experience, but 2 in this space. Let me say it that way. But for this, we are there. It's a new thing. So yeah.
What podcasting is new. But you worked for 4 years as a journalist.
It's an experience, not just entirely a journalist.
After graduation from training.
If you count after graduation, I'd say 2 years. Because there's that part where before graduation we had the interning for us.
So you've only worked for 2 years?
Yes.
Okay.
Why?
No, I'm just curious.
I don't look it.
Well, you don't look it. I'll be honest.
I answered that question when, of course, the people are out there, but then you asked me how long I have been in Nairobi, remember?
Yeah, but that doesn't mean anything.
Regardless, because I'm in Nairobi, and that's when I started my career journey.
You can be an up-country journalist if you see yourself.
It's not easy that way, especially when you do not really know a vernacular language. Nairobi is a center of, or other towns which are more like cities now, the ones, Mombasa.
So where did you train in journalism?
Moi University.
Oh, in LD. Okay.
Yes, KSS. It's good to specify KSS for
us. KSS?
Hey, it's a good school, but then it's interior. Like you can't say Eldoret because it's the outskirts of Eldoret. Yeah. Literally, it's 1 hour by even almost 2 hours. Yes. Do you have another question?
No.
Okay, I have a question for you.
Yes.
Have you learned something from me? You know why I'm asking that question is because the other way around, we as young people, we always, it's not even asked. It's a thing. You need to learn something from an older person. I didn't want to say old.
No, so I've learned about complexity of multi-ethnic families. Yeah, because you can't answer the question of what are you, and the answer is I'm a Kenyan.
Yes, I am a Kenyan,
and that's the overall trend.
It is now.
That's picking up along that. You can't be put in a box because it's very complex.
Very.
Yeah.
Okay, now a book or resource every leader should read.
So I reflected upon that, and there's a book, and I realized somebody pinched it from me. Yeah, okay. It's a book called What They Don't Teach You at Harvard.
Wow, I think I've seen that book.
A lot of people have
just the title.
haven't read it because the book was written during the time where it was very fashionable for people to do Masters of Business Administration, and so this book is a very practical book written by somebody which helps you in making decisions, business decisions and leadership decisions, because you will not learn what he's talking about from going to class and doing an MBA. And I think that's a book that if somebody is aspiring to be a leader, should read.
Okay, great. Now, a good question. Before you became a leader, before transitioning to, I can't say before you became a leader because that's the question I have to ask. Before you now becoming as a leader in the healthcare, prior, in your younger age, either in primary or in your schooling age, in hospitality as well, did you serve as a leader as well? Was it something that was within you, grew?
Yes, I think I've always stood up as being confident and outspoken. So I'd always have leadership roles, whether in primary school, in high school. When I was in college, I was my house captain. I was, of the sports facilities, and then when I trained, I trained in hotel management. So that's really, I was training to be a leader because that's so I wanted to lead. So that's why I went into management. So it's just something that, yes, I had a strong desire.
Okay.
To lead.
Now, in that position of you being a leader, of course, I'm well to assume that you have been an employer. So what is that one thing that you'd want that's not in a degree?
You see, a lot of people think they show their degrees or their certificates and say, this is what I have. The degree and the certificate is not the one that does the work. The person that does the work is you as a human being. And so you've got to have a very high sense of awareness. So when I say that, you really got to know your personality. You've got to know how you relate to other people, and you've got to be able to appreciate what you're good at and what you're not good at, and then try to keep learning. So if you're able to do all those things, then you will do a lot more than that degree or certificate that you have. So
with an example with me, in that scenario where now we are in an office, I've come in with my papers, how do you get to now pick? Because my papers show what I am sure. That's the degree, of course. Now, with everything that you've described, how do you get to assess that?
It's a much abused word, which is called attitude. Yes.
Okay. What attitude do I give off?
You can
You can read that.
You can read.
But people are great at hiding.
No, you can't hide at it. It's there's an English word which is called countenance, and it's born from the fact that Caucasians, you can read everything, emotions from their face.